Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Welcome, Dr. Darrow, and welcome everybody to Living Pain Free.
Thank you, Nita Valens. We've actually got a caller right now, which is cool. His name is Mike. He's from Cyprus. And Mike, I understand that your right shoulder bothers you, and you've been told you have a rotator cuff tear. How long have you known about this?
Mike, are you with us? Hello, Mike.
Hey, Mike.
Mike.
Mike's not on the mic.
Mike. You are going to be funny today, I can tell. Yes.
Katie, yeah, good job. Mike, this is Dr. Marc Darrow, and you must know who I am because you were right there at the beginning of the show, which is really cool. So we can get right to questions, and I can explain what regenerative medicine is and how we can heal issues like arthritis or joint pain, tendons, ligaments, anywhere from the back of the head all the way down the body, neck and back, down to the hips and knees and your shoulders, hopefully, the feet, the toes, the ankles, you name it, elbows. If you know me, Mike, you know that I've injected both my knees, I've injected both my elbows, both of my shoulders, and I've had other people do my neck and back. Oh, I forget, I did my right wrist first. That was many years ago, then my shoulder was second. And I've had very, very good success. It's not something that's going to work for everybody for many different reasons, which I can get to after we figure out what's going on with you. I don't want to keep you waiting anymore. And thank you so much for calling in. So how long has your shoulder bothered you for, Mike?
It started 2 months ago. I was hitting golf balls at the range, and I was hitting my driver, trying to hit it harder and harder, and ended up getting some pain in my shoulder. It was pretty bad, really.
Which shoulder is it? Is it your right?
It's my right shoulder, yeah, and I'm right-handed.
Okay, good, double right. So what's probably happening? Are you hitting off of mats? Are you hitting off of grass?
No, mats, hitting off of mats.
And you know as well as I have, both of us being golfers, we shouldn't be hitting off of mats. Okay, but
right.
It may have been because you were doing the driver then, which exacerbated it. But you also hit your irons off the mats too, right?
Right. Yeah, that's true.
Okay, so the driver is not as bad an issue on mats at all because you have the ball teed up off the mat, but you're still hitting you're hitting irons off the mats, which means that you are stopping the golf club, and every time you stop it, you jerk your shoulder, and I could probably tell you exactly where it is just talking to you. It's probably the supraspinatus tendon that's probably worn down or torn. And let me ask you, is that the truth?
Yep, I've got a high-grade partial tear of the distal insertion of the fibers of the supraspinatus tendon.
There you go. See, I knew that even before you told me because of what you're doing to yourself. So, number one, all you golfers, and I get tons and tons of golfers that come in to see me. People say, who don't play golf, they say, golf is not a sport, it's a game. And I don't want to do it because it's boring. But guess what? The golfers that I take care of have more injuries than anybody else because golf is a sport where you're swinging. I don't know how fast your swing is, but if you're a good golfer, you're swinging 120 miles an hour. If you're an average golfer, you're swinging like 70 or 80 miles an hour, but never mind, it's still fast. And when you hit that mat, you're hitting like a brick. There's a little fuzz on top of it, that green stuff. But it's not good to hit off of mats. So if you're at a driving range, try to find a place next to where the mats are, where there's some actual ground or grass. Like if you went to Rancho Park, there's an area all the way at the end that you can hit where there's no mats. So I knew what's going on with you immediately, and without you even telling me, because I'm a golfer. And I also have a rotator cuff tear in my right supraspinatus, just like you, from hitting off of mats. Okay? So I'm a dummy just like you're a dummy. Nothing against us.
Do you have a high-grade tear? Because research I've done, it says that 70% is a high-grade tear. It's torn 70%.
Okay. None of that has anything to do with your reality of your pain. So I have to tell you that. And what I'm trying to get at is you cannot look at an MRI. You did have an MRI, I assume, yes?
Yes.
Okay. MRIs are big liars, okay? They show things that aren't even there. How do I know? Because we do studies, and we take people that have zero pain in the shoulder, and guess what we find? High-grade rotator cuff tears. When we take people that have no back pain, what do we find? Herniated discs, spinal stenosis, on and on and on. So don't equate your MRI with what's really going on with you. It may be and it may not be. But I have a tear in my shoulder, and I have three. I have a rotator cuff tear in the supraspinatus, just like yours, in my subscapularis, which you don't have, and in my labrum, which is a lip. Labrum means lip in Latin. It's a lip around the humerus bone that helps hold it in the glenohumeral joint. I have all three of those, but I'm lifting up my arm right now, and I'm getting ready to play golf later today. I actually have a 3-hour lesson, if you can believe that. I'm an addict, and I don't have any pain. So don't get caught up in your diagnosis, and when your orthopedic surgeon says we have to operate on you because you have a rotator cuff tear, that is, how do I describe it? That is, Nita, you got a word for it?
Pain.
You're smart. Well, pain, but it's old medicine. It means it's the stuff that people that don't even know what they're doing anymore are doing. Arcane. You hit it. Yeah, it's arcane medicine. It's medicine that shouldn't be done anymore, but it is. And that is the culture of orthopedic surgery. Find something that doesn't look right, and if you have pain, operate on it. Now, I know a lot of orthopedic surgeons and studies that will go in for, let's say, an ACL rupture in the knee. That's the anterior cruciate ligament. And they'll go in, open it up, and they go, geez, it's not torn. So why did they create trauma when they didn't need it? Surgery is a big trauma. I had one, as you probably know, Mike, you probably listened to the show before. I talk about it pretty much every show. I had a surgery on my right shoulder. That's before I even had any tears. I had what's called impingement syndrome, which is a bunch of malarkey. There is no such thing. But that's what guys get operated on. I was a dummy. I was in med school, and my shoulder was hurting from a weightlifting injury, where I basically just stretched out the capsule and the rotator cuff, just to stretch, doing wide bench presses, my hands wide and deep, to build up the lateral pectoralis muscle so I'd look cool on the beach. What a dummy I was having that surgery. And I loved my professor who did it for me. I actually begged him to do it. I had a break in my schedule in medical school for a couple of days, and I said, would you please do it? He goes, well, I'm not so sure that we can get you in. And I said, please get me in. I got to fix my shoulder. What a mistake I made, because that shoulder blew up like a balloon full of fluid, and it never healed. I had a fever afterwards, and I had blisters on my shoulder, these giant blisters, and I was really freaked out. I thought it was infected. It wasn't. It was just a bad effect from a good surgery. You know what I mean? we hear this in medical school. It was a perfect surgery, but the patient died. Okay? There are people that actually die on the table. It doesn't happen all the time, but I've been there when it's happened.
The orthopedic surgeon I've gone to is well respected in the area, and he said that stem cell therapy, as it is in the United States, would not repair a torn supraspinatus tendon.
And I am of the religion, if you want to call it that doing a surgery on your shoulder can make it worse. So we don't agree with each other, and that's fine. Doctors don't have to agree with each other, but I've been doing this work for close to 25 years with amazing success, okay? Most of my patients heal, not all of them, for many reasons. I'm going to tell you why people don't heal. By the way, let me get my phone number to the studio out to everybody listening so we can get more callers in, because we're going on for a long time, which is cool. But the number to the studio right now, if you want to get to me after Mike, is 866-870-5752. I'm going to repeat it for you. Get your pen and pencil and write it down. 866-870-5752. I want to talk to you right after Mike. We'll have a good time like we're having with Mike right now. And Mike, I want to thank you so much for your call, because you've opened up so many issues that I want to talk about and educate people about.
Thank you.
And you're going to get a free book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you want to get an extra copy, I'll send you two, one for you and one for your surgeon. Because the surgeons are, I'm just going to say it the way it is, they're dinosaurs. I have very, very close friends who are orthopedic surgeons, and we argue about this. We argue about the topic. They go, it can't work. And I go, well, then why do you do it? Well, I like to give it a chance before I do surgery. And that's not the way it works. You've got to do it enough so that you grow enough tissue to get rid of the pain you're having. So the failure reasons, the reasons people don't heal are because they go right back to their activity. Now, if I inject you and you go right back to hitting golf balls off those mats, you're not going to feel any better, okay? You might feel worse. That's number one. Number two, people take ibuprofen and other NSAIDs, non-steroidal anti-inflammatory drugs, and that blocks the growth of tissue. So all you people listening who take that junk every day, guess what? You're actually hurting yourself. The body knows how to regenerate itself, but when you take that, and it does it partially through inflammation. So when you get a swollen ankle, when you sprain an ankle, that's the way God sets you up so you could heal. You need that inflammation to bring fibroblasts to the area and bring blood to the area. Blood carries oxygen. Oxygen heals. Another reason people fail is they get a bad doctor. They go to a chiropractor. The chiropractor hustles them to do stem cells or some other treatment, and he loads up a day of patients and brings in a doctor who doesn't even know what they are doing. And maybe they'll bring in a nurse who doesn't know what they're doing. That's bad medicine. Another reason is doctors who don't use ultrasounds for the shoulder, the knees, or the hips. They're not even getting that solution into the joint. Okay? And then the final reason, you don't get enough treatment. You go in and you get it done one time, and you might feel a little better, you might feel a little worse, because we do create inflammation by doing this, and then you quit. Because your surgeon said it can't work. It works. I promise you it works. It may not work on you, but it works on most people. And I can also promise you this. I am loaded with patients who have had failed surgeries, like the one I had on my shoulder. So go tell your surgeon to wake up. I love surgeons. This isn't about your surgeon. It's just about the culture of surgery. Tell your surgeon to wake up and learn about regenerative medicine. Read the studies on it. I laugh all the time when people say, I love your book. How long did it take you to write it? And I say, it took me 5 years of getting the research. The book is full of research. There's about 250 studies of research on it, showing why surgery is not the best thing to do and why regenerative medicine is a great thing to do. Now, I don't just go and I don't do this on everybody. I pick out the patients who I think it's going to work on. I do rarely send people to a surgeon when I think that I can't help them. So surgery is a great thing when I'm going to say the student, it's not the student, but it's the patient who is the right candidate for the surgery. If you've broken a bone and the bone is sticking out of your leg or out of your arm, you better get to a surgeon right away. But for rotator cuff tears, for spinal stenosis, for herniated discs, for neck pain, back pain, I don't think surgery is the right thing to do. It may be, but I've got to examine you first. So go ahead. You were going to ask another question.
I don't want to get to the point where it tears completely.
Well, why do you think it would? Who told you that?
Well, I just my own, thinking about it is that if it's 70% torn and there's only 30% left there, is that strong enough to hold up? And I do end up.
It's a great question.
In my
great
activities,
question.
I hit golf ball. I play golf, and I also swim. I was a competitive swimmer in college.
Oh, good.
To swim.
Good. Okay, let me give you some information. Number one.
Okay.
You hurt your shoulder 2 months ago. I agree to that because you're telling me that. You know when it started hurting. But what you don't know, Mike, is when that tear occurred. How old are you?
70.
70, okay. I'm 73, so we're in the same ballgame. You may have had that rotator cuff tear for 50 years and not known about it. Did you hear me tell you I've got 3 tears in my shoulder and I don't have pain?
Right.
So don't get all up and tight about the fact that you have a rotator cuff tear that's 70% and you're worried it's going to tear all the way. I've treated endless patients who have complete rotator cuff tears who feel better. Did the tear heal? No. Why do you think it's the tear that's causing your pain? Don't get lost in that old paradigm.
Okay.
Most active guys our age, guys who are sports addicts like we've been, have rotator cuff tears. That doesn't mean they have any pain. And it certainly doesn't mean they need to get a surgery. Do you understand that?
Okay. Yeah.
So for me, when I have pain, and I get pain all the time because I go crazy doing repetitive sports, what do? I inject myself and get myself better. I'm going to throw out the phone number one more time, and I'm still going to keep talking to you, so hang with me, Mike. The phone number to the studio right now, I would love to talk to you, is 866-870-5752. I'm going to repeat it, 866-870-5752. And if you'd like to actually call me at the office and get more information, maybe you're shy, don't want to call the radio show. I hope you're not shy because we're having a great time. The phone number to my office is 800-300-9300. That's 800-300-9300. And if you'd like to watch me doing videos, actual procedures on videos, go to my website, www.lastemcells.com. That's www.lastemcells.com. And every page has a spot to email me if you're too shy to talk to me live. But I hope you're not. I'll take good care of you on the radio. Mike, you're having a good time learning things. So, Mike, I heard you wanting to ask another question. Do you have any more questions? I'm willing to go with you as long as you want.
Well, the pain has been kind of bad at night, and I take some. I have been taking some Aleve or NSAIDs, but I also take some Tylenol.
Okay.
Acetaminophen.
Yeah.
So is Tylenol, is that okay?
It's okay for the healing part because the body, it doesn't get rid of inflammation. It just gets rid of pain.
Okay.
So that part's okay, but you don't want to take too much Tylenol either. It can affect your liver. And I don't know if you know about this, but young girls who try to commit suicide, one of their favorites is taking a bunch of Tylenol or acetaminophen. And most of them don't die from it. They just end up in the ER with a rectal tube of a medicine that will get rid of the Tylenol they put in their system. So it's a very awful way to get sick and then get brain damage and all kinds of damage from it. So I wouldn't take too much Tylenol. And definitely the Aleve is not good for the healing part. Either one of those in excess, and you're going to have problems. The NSAIDs...
I try not to do either one of them.
They affect the kidneys more. And I've had 2 patients that were taking excess of anti-inflammatory drugs ending up in the intensive care unit bleeding to death. So you got to be careful. These medicines are not good. There's no medicine that's a great medicine. Every medicine has a side effect. Some we need to take. If you have a heart issue of some kind, then you probably need the medicine. But you got to be careful taking any kind of medicines, and there are natural ways to do things. Right before the show, I got a call to my cell phone, and it was a gentleman in Santa Monica who was having problems with his nerves, and he asked if alcohol was an issue. And I said, yeah, alcohol and diabetes are the 2 main issues for causing peripheral neuropathy. And I think, I forgot what he said he weighed, but he was way overweight. And he said, could I help? And I said, well, I can get you on a ketogenic diet. And if you listen to me, you'll be skinny again, and you stop the alcohol, and the nerve damage will stop. I don't know if it'll keep it from happening, but it'll keep it from progressing. So there's a lot of things that can be done naturally, even without going to doctors. And I'm a big believer on diet. Diet, I think, is the whole key to health. And if anybody is out there who's overweight, you're basically killing yourself early. I'm sorry, it's just the way it is. Studies on longevity at UCLA showed that people that are overweight are losing anywhere from 8 to 10 years of good life. We create metabolic syndrome, insulin resistance, and a whole other things, including type 2 diabetes, that lower the number of years of our life. So we've got to be smart about taking care of ourselves, and going to doctors isn't necessarily the answer. You got to do your own homework and figure out what to do yourself. And this is a nice natural medicine that I do, regenerative medicine using platelets. We call it PRP, which comes from the blood. And then stem cells, which we get from bone marrow, also has platelets in it. So regenerative medicine to me is the key in the musculoskeletal system. But if you're overweight, I'm going to put you on a diet at the same time, okay? Because excess weight around the midsection, every extra pound there is an extra 5 pounds of biomechanical pressure on the knees. So if you've got knee pain or you've got arthritis in your knees and you're overweight, guess who caused it? You. What else you got?
Well, after getting an injection for the shoulder, how long can you expect before you'd end up being able to go back to playing golf?
That's an individual question for a patient that I can't tell you until I examine you.
Okay.
Yeah, everybody's different.
I guess that's all I have then.
Yeah. I don't think you're in bad trouble, Mike. I think what you've got is probably not even causing your pain. The rotator cuff tear I don't think is causing your pain. I think you're in the middle of what we call an overuse syndrome. And get off the mats if you're having shoulder pain. Don't hit on mats. Hit off the ground. And, you don't want to hit off of hard ground. Think about it. Think about what you're doing to yourself.
Right.
Get smart.
No, I hear you about the tear, because it seems like the pain is kind of, it migrates all over the shoulder. It's not, and the supraspinatus tendon is up at the top of the shoulder, right?
Well, it wraps around from the supraspinatus muscle underneath the acromion. You should just go to Google and put in supraspinatus tendon and click on images. You'll see it. It wraps around, and it's the tendon. The muscle actually, when it contracts, pulls on that tendon. See, tendons are tissue, fibrous tissue that attaches muscles to bone. So when you contract that muscle, it lifts the arm up the first 15 degrees in abduction to the side. And anyway, take a look on Google. You'll learn a lot. Everybody who's got an issue, type in whatever that issue is, and then go to images, and you'll actually see the anatomy, and you'll learn an awful lot that way. So I spend a lot of time with my patients showing them their anatomy, because most of the time the diagnosis they come in with is not what generates the pain.
Okay.
You got to get educated to keep yourself.
Very much.
Yeah, you got to get educated to keep yourself from a needless surgery. It's just the way it is. God bless you, Mike.
Right.
I appreciate your call, and I'm going to put out the phone number again so we get some callers in here. It's 866-870-5752, 866-870-5752. I would love to talk to you. We're going to the break.
We
and
are.
If you want to watch me doing these procedures on videos, go to the website, www.lastemcells.com.
All righty, you're listening to Living Pain Free with Dr. Marc Darrow. We're going to take a quick break here, but give us a call, 866-870-5752. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.